Welcome to First. I'm Mark Eichman along with Shirley Min and Nichelle Polston. A Wilmington neighborhood is discovering the path to rebirth can be as simple as planting fruits and vegetables to rid their community of blight.
A local teenager looks to inspire her peers to excel in school this year and reach for careers in science, technology, engineering, and math.
And we take a trip to Safety Town, where a new generation of preschoolers are learning important and timeless lessons. First, your public media news magazine starts now.
Bringing back Wilmington neighborhoods continues to be a top priority. The city's East Side community is no exception. Urban Acres Produce is among the revitalization projects underway there. It's producing healthy foods and hopefully fruits of a different kind for a community working its way out of poverty, crime, and low levels of home ownership. Check out Urban Acres Produce in this week's First Look. A new Habitat for Humanity home construction project called Hope Run is rising on Wilmington's East Side. Habitat, along with Central Baptist Church's Community Development Corporation, are among several partners working on East Side Rising projects aimed at creating economic empowerment, a viable housing market, a strong workforce, and a safe and healthy community.
You are in the Urban Acres garden, and our garden started out as having nothing here. 2 houses were demolished, and what you see now is the finishing touch of a beautiful garden come together for East Side residents. This is kale, cabbage, this is broccoli, we have onions, and we also have growing here are okra.
Reverend Terrence Keeling and Mike Miner are the catalysts behind Urban Acres Produce.
We started Urban Acres really for 2 purposes. One, because this was a what they call a food desert. There was no real way of people obtaining nourishing food.
The American Nutrition Association defines a food desert as areas where residents can't get healthy food like fruits and vegetables. The poor, elderly, young, and sick are often the ones who can't access these foods, so Urban Acres brings it to them. They operate several stands outside senior housing centers and clinics around the city on Tuesdays through Fridays. The fruits and vegetables are locally grown in the garden at 8th and Church Street, right in the heart of the East Side.
The plan was always to have 10 beds for the community, and then the rest of the beds would be for our Urban Acres production, where we could actually grow fresh produce, and really not with the idea of selling it on our stand so much, but what we really wanted to do was to grow produce for some restaurant in town, so that the restaurant could say, we're buying local on Church Street. People, think Church Street, how can you buy local from Church Street?
Well, it's not restaurants, but residents buying local from the garden. Community buy-in is critical to the garden's success.
Before I moved here, I moved from Greenville, Delaware. My husband and I decided that why are we sitting here in the lap of luxury when we need to be somewhere in the community helping?
Althea Alfie Moss, whose first name is a flower and last name is a plant, is, of course, a natural in the garden. This project was perfect for her. And she's not alone. Garden manager Tina Leatherberry has lived on the East Side for 34 years. She's one of only a few homeowners on her street. According to a 2010 census, 64% of homes on the East Side were occupied by renters. Leatherberry says she thinks the garden and new construction will bring committed residents to the area.
Now the buildings are all boarded up, getting ready to put through new houses and hopefully new neighbors that want to be here and keep the area up.
And it's not just residents pitching in. Miner doesn't live in the area, but he's invested in the community surrounding the church where he worships weekly. The 73-year-old says his idea of retirement was interrupted.
Reverend Keeling showed up, and my life changed. He came in 2010 and said, we need to do something. And that's everything just is going from there. This was not something in the plan. This is not some vision. This is not, and I tell people even now when people come and they tell me how beautiful this garden is, and I only have to be honest and say, I wish that I could have had a vision that this is what this could look like. I had no clue.
Someone who did have an idea what could come out of this project was Reverend Keeling.
Part of what we do is we want to change the narrative, first in the people's mind, and then overall throughout the city. So part of what we had to do was make people believe that, hey, that this time something really is going to happen. We didn't allow them to ask us, well, what are you going to do about so-and-so? No, it's not me. It's what are we going to do?
That call has been met with a response. There are 26 beds in the garden, 13 are owned by residents, and the others are used for production to sell at the stands. Always forward-thinking, Miner says he has an even greater goal for Urban Acres produce.
We want to be the distribution hub for this area. And we're right here by the port, so even in the winter, as the produce comes in from South America and around, and it goes right through Wilmington to Philadelphia Produce Market, we'd like to have some of that stop here in Wilmington. So we can bring those pieces together, that we could have a hub here, that we could be a full-fledged produce hub in Wilmington, create jobs, create enthusiasm, create welfare, just do a lot of things for our city.
Urban Acres Produce is an example of the power of partnerships. The Wilmington Housing Partnership donated the lots where the garden is located. The plants come from H.G. Haskell Farm in Chadds Ford, Pennsylvania.
First person this week is the head of Delaware's Department of Health and Social Services, Dr. Kara Odom Walker. Secretary, thank you so much for being here on First.
Thank you for having me.
I want to start with the addiction crisis. We'll start with the national headlines and make our way down towards Delaware specifically. But I want to start with your reaction to President Trump's declaring of a national emergency as it concerns the opioid crisis.
You know, out of all of the things that the federal administration can do to support states right now, I think bringing attention to the opioid crisis is one of the most important. So we're so thankful of having potential for declaring federal emergency and having additional resources come into our state. And that can be something as simple as allowing us to share data and information across our agencies in a better and more effective way. It could be about reorienting how we provide some of our treatment services, or allowing additional providers to be able to prescribe effective medications like Suboxone to patients and families who really need it. We all know that people are dying due to opioids, and so the more we can bring naloxone into households and family units and make sure that naloxone is available to save lives, the better. And so we're really hoping that we can have additional permissions and strategies to address this crisis. It's hitting our state very hard.
So that brings me to the next question. In Delaware, how bad is the problem here in the state? Are we seeing pockets where it's particularly bad, or is this a statewide problem, bad overall?
Absolutely. It's a statewide problem. It's affecting people, young, old, from all races, all neighborhoods. And, it's gone so far that we have seen more deaths due to opioid overdose than we have traffic accidents. In fact, we're up to, over 130 deaths in our state. And so that is a real problem. Last year, we were at 308 deaths for the year. And we're hoping that we can stem that tide and help get more people into treatment and help decrease that. But when you have 2.5 times the number of deaths than you have traffic accidents, we have to treat this as a crisis, as a real need to create opportunities to catch people when they're ready, get them into treatment, and help people with the addiction wherever they are.
So Delaware recently tightened the rules for doctors who prescribe prescription painkillers, which has been linked to the heroin crisis, other opioid addictions. Governor Carney signed a law making naloxone more available. These are some critical pieces, right, in fighting this crisis?
Absolutely. We have to have a multi-pronged strategy to pull all of the resources and focus on making sure that people aren't getting started on opioid medications when they don't need it. I'm a family doctor, so we want to make sure we're addressing people's pain. For acute issues, we want people to have pain management. But if people have been on it for a very long time, we know there's a risk of becoming addicted. And there has to be a relationship with the physician to make sure people are kind of weaning off of the things that aren't effective or putting them more at risk. But that is, again, the reason that we need to address naloxone, address treatment, make sure that we have appropriate prescribing. We know that 80% of the time people are actually getting started on heroin because of using pain medications early on. And so anything we can do to make sure people aren't transitioning, it's a brain disease. We really have to address this together.
I want to go now moving on to the Affordable Care Act. You know, how has DHSS weathered all these ups and downs? You know, we might repeal it, we're going to replace Obamacare, we're not doing this, we are doing that. How have you weathered those ups and downs?
We keep watching and we're being patient, and we know that at the federal level there are many moving parts. So what we're trying to do is figure out what the state can do to leverage the promise that states will have increased flexibility to address issues around payment and delivery system reform. And so we're very fortunate to again have the leadership of the legislature and the governor, where they are planning to have an executive order signed in September that says Delaware can set a healthcare benchmark for spending in healthcare. And that's going to be an incredible tool for us to create a plan that says Delaware is now at a place where we can't continue to spend more and more in healthcare. This is affecting everyday families who are trying to figure out what to pay. Their premiums are going up. We know that small employers are having trouble providing care. There are less options on the exchange. So our state is trying to figure out how to deal with it ourselves and not just rely on what's going on at the federal level to address coverage and access and better quality care. We are now, as a state, the third highest per capita in healthcare spending in the nation. There are only 2 states that are higher than us. This, again, is an opportunity. Yet, when you look at what we're paying for that cost, we're only 31st in healthcare rankings. We're pretty low. We have a lot more to do to get people healthier and pay for things that are really around value instead of just visits and volume. So we're planning to bring stakeholders together to figure out what our state's plan will be to address increasing healthcare costs and growth.
I want to talk lastly about the CDC report on violence in Wilmington. You know, the final report came out. What steps have been taken since then?
So the CDC report was instrumental in bringing together stakeholders who are trying to address the underlying issues of poverty and lack of education in our city of Wilmington. We know from that report there's something like 200 kids and youth who are either going to commit gun violence or succumb to gun violence. That seems like a manageable number. So we've been having multiple meetings on a weekly basis to try to figure out how do we provide wraparound services for families? How do we address the issues of education and empowerment? How do we get families into jobs and supported by our social services and programs in a different way? And that is a huge part of what came out of the CDC report. The other part is the power of data-driven decision making can be incredibly valuable to know what programs are working and what's not working. And so one of the recommendations in that report was for the state to come together, bring coordinated services across agencies to make sure we know what's happening for each individual family that's trying to seek opportunities for their children, the young people, and for adults in the family and household.
A lot on your plate.
A lot on the plate.
Dr. Kara Odom Walker, Secretary of the Department of Health and Social Services, thank you so much for being here. And you can watch this entire interview in its entirety at newsworks.org/Delaware.
Coming up on First, the state of the environment takes center stage at the Rehoboth Art League. Plus, Newcastle County is putting safety first by teaching the next generation some important lessons. And a group of young women in Wilmington are pumped for the school year because of the lessons of empowerment they learned this summer.
It's now time for a quick solar eclipse lesson. It's courtesy of the folks at the Mount Cuba Astronomical Observatory. They're preparing for one of the most viewed astronomical events in human history. Early Monday afternoon, the first solar eclipse visible in the U.S. in more than 30 years makes its way across the country.
We have the moon that orbits around the Earth, and the Earth rotates. And every once in a while, the moon gets between the Earth and the sun. And so it will look like it's covering the disk of the sun. It's actually kind of a lucky thing.
Lucky because the size of the moon compared to the sun and the distance between the two makes for a near perfect visual match.
The moon's diameter is about 400 times smaller than the sun's diameter. And the sun's distance from the Earth is about 400 times further than the moon is. So it's a cosmic alignment where we have the moon exactly the same apparent size as the sun.
It was a solar eclipse in the 70s that inspired Judy Provençal to study the stars.
That's one of my first memories when I was a kid of astronomy, was seeing an eclipse. And ever since then, that's all I wanted to do. So I'm hoping that something will happen. Because astronomy is changing, and there's so many things going on right now, and we need more astronomers. So it would be nice to encourage people to think about astronomy.
While Delaware won't get a total eclipse, the moon will cover about 80% of the sun locally. Mount Cuba Observatory is already fully booked for Monday's eclipse. Those in attendance will use this historic telescope built in 1887 to gaze at the eclipse.
It's been here since the 1970s. It was donated by the DuPonts. But the first thing you got to remember to do is put the solar filter on. Otherwise, we're going to fry people's brains.
Whether using a telescope or not, it is unsafe to look at the eclipse without special eyewear.
Don't look at it without any protection on your eyes, because you can hurt your eyes. Even with 80% of the disc covered, it still can hurt you. There's a lot of photons coming off of the sun, and you don't want all those going in your eye all at the same time. It's like a little laser.
Because the eclipse is the first across the entire nation in 99 years, it's believed this event will be historic.
So this one, and in the age of the internet, and everybody has a camera nowadays, so it's going to be the most watched eclipse probably that's ever happened.
Provençal hopes all those who see it will be inspired.
One of the things I really like to do is to have people come and look through the telescopes, especially kids. You know, they look through the telescope and see the moon for the first time, and they go, oh, wow. And that's just fun. So I'm sure the same thing's going to happen on Eclipse Day.
The length of the total eclipse is only about 2 minutes 40 seconds, or just a few seconds longer than the story you just saw. There are lots of state parks and other spots hosting eclipse watching events, and hold on to those eclipse viewing glasses. Another total solar eclipse will darken skies from Mexico through the northeast U.S., including Delaware, in 2024.
Did you just tune in? Can't stick around to watch the rest of the show? Well, go to WHYY.org/first to watch Delaware's news magazine when you want. Past shows are there right now.
For 33 years, kids in Newcastle County have learned things like how to dial 911 or stop, drop, and roll through a beloved program called Safety Town. It's been around so long that now a new generation of children are learning these important and timeless lessons. These kids are learning the rules of the road here in Safety Town.
What do you do at a stop sign? What do you do at a stop sign? There you go.
This miniature town with child-sized buildings, crosswalks, and streets is part of Newcastle County's popular Safety Town program. The week-long program teaches 4-, 5-, and 6-year-olds about safety through hands-on activities like this and visits from guest speakers.
Can somebody raise your hand and tell me one thing you've learned in Safety Town?
On this day, Newcastle County Executive Matt Meyer came for a visit.
Good. You don't cross the road till the bus puts the sign up.
And so did PA Bear with Prevent Child Abuse Delaware to talk about good touches and bad touches.
The goal is to make them more aware of safety. We hope that the concepts the children learn will never have to be used. We hope they don't have to dial 911. We hope they don't have to know how to get out of their home in case of a fire. But the idea is that we've planted the seed. If they need this information, they have it.
Bryce Kerstetter took part in Safety Town when he was younger. The high school freshman is back, this time as a teen volunteer.
I feel like it's giving them a sense of how the world works. You know, it's a lot more dangerous than what it may seem. And just teaching kids, you know, when they do go out there and they do need to do things on their own, they'll be set and prepared and ready to do it.
Safety Town started in Ohio in the 50s and 60s, back when safety wasn't taught in the schools. Crossing guards started it here in Delaware in the 80s to teach kids how to cross the street safely. And then the program just grew from there. Dougherty says the county spends very little on marketing, but that word of mouth has kept the program going strong for 3 decades.
Well, safety never goes out of style. People are always interested in having their children learn about safety.
So much so that Safety Town is now teaching a whole other generation of kids. Both Alan Sylvester and Rhiannon Barlow took part in Safety Town as preschoolers. Now their kids are in it.
And remember a lot about learning your phone number and just general safety.
So you're reinforcing with things at home, but they're presenting it in ways that are, studied and planned, and in ways the kids will understand it better. And then you're reinforcing at home with the same kinds of conversations about all the topics discussed.
Important lessons wrapped up in fun.
What are you coming up to? Keep going. And stop. Oh, great job.
600 kids took part in Safety Town this year. 13 week-long sessions at various sites are offered during spring break and throughout the summer. The program is done for this year, though, but registration for next year opens in February. It's $70 for Newcastle County residents, $80 for everyone else.
The new school year is fast approaching, and a local student is determined to get her peers excited about heading back to the classroom. Her technique? A few science projects and more.
This is taking a little bit longer than I expected. Yeah.
But patience combined with borax powder, glue, water, and your choice of food coloring, and you'll get a little something called slime.
Slime is popular. I've seen it all over Instagram and Facebook. We're doing an elephant paste one soon. It looks cool. It explodes and makes a lot of soap and foam. That one's fun. Just want ones that catch their eye to get them interested in it, so they can go home and be like, oh, I want to do this one or this one.
That's exactly what 14-year-old Jacqueline Means did. Catch everyone's attention during the Girls Empowerment STEM program.
Whoa, this is really cool.
Means developed such a strong love for science and math that she decided to host the event to bridge the gap in women in STEM by introducing these girls to a few lab experiments.
I wanted to bring science, just STEM, to girls in Wilmington, especially girls of color. She had read that there's a shortage of women in STEM, and there's even a smaller percentage of minority women in STEM. And she said, well, I'm going to be a surgeon. She said, I want other girls from Wilmington to at least get interested in science, and maybe they'll be surgeons.
Congresswoman Lisa Blunt Rochester also participated to spark students' interest, where they all came together to create oil lamps.
I think because we live in the city of Wilmington, it's important to give back, because the youth are the ones that are going to make a difference as they get older. So if you can impact the youth and get them to see other people giving back, get them interested in chess, STEM, all types of things, our community will get better, but you have to invest in the youth.
And investing in the youth is certainly the goal of every inspiring woman who attended.
How many of you guys know that school is important?
Then another speaker, Velda Jones Potter, who was the first African-American woman to earn an engineering degree from the University of Delaware.
If you love math and if you love science, engineering could be a career for you. That's all I needed to hear.
It didn't take long for students to feel empowered.
I'm going to be a teacher.
A teacher? Wow, wow.
The goal was to get these girls thinking about their future. That's why Means carefully picked each science project, such as the balloon experiment.
So the vinegar and baking soda balloon, because the vinegar and the baking soda have acids in them that mix and make carbon dioxide, it fills up the balloon. And that's one that they can really see a reaction, and it's not like, oh, what's happening? You can really see what's going on.
In fact, there's more in store for students and plans to keep them involved in STEM throughout the school year.
We're going to be doing these every 3 months, so brace yourself, because Jacqueline wants to make sure that this is a consistent thing with the girls, not just a one-time thing. So we will be doing this again and getting girls interested in STEM and doing many more experiments.
With a little push, they're sure to be empowered and ready to do their best in school.
I'm smart. I'm smart. I'm beautiful. I'm beautiful. I'm incredible. I'm incredible. Are you incredible? Yeah, she did that. And I rock. I rock. One more time. Girls rock. Girls rock. Girls rock. Girls rock. What do girls do? Rock. Rock. Yes. All right.
Students walked away with more than just a greater sense of science and math. They also took home some school supplies to help each of them have a successful school year. Some of the contributors included Healthy Kids Delaware, Nemours, Park and Recreation, ShopRite, and a host of others. It was truly a community event. Artists have always interpreted the world around us to tell stories or to shine a light on an issue. In the case of a new exhibit at the Rehoboth Art League, the environment takes center stage. Global warming, climate change, extreme weather are just some of the things that inspired the League's artists to create works reflecting the changing world around us. It's this week's First Experience.
This exhibit is one of our member showcase exhibitions. So the theme for this exhibition is environmental impact. So the whole idea was to just heighten awareness of the environmental changes, climate change. I was nervous about the theme and what the artist would come up with. I thought people might be literal, mainly just show beach erosion, which is sort of important to us in this area, but some are more conceptual, some of which are not obvious unless you know the history behind the artist and the work. Some are just beautiful works of art. People tackle the pollutants in the earth, pending destruction of landscapes, chaos sort of within landscapes. It was a really wide variety of interpretation. I think all in all, it's probably one of the strongest shows we've had just in terms of diversity and the quality of the artwork. It's a very serious topic. A lot of the works in the show do show chaos, so I think it's very important and the artists sort of grasp that visually. Artists have a way of sort of telling a story, having a narrative in a way that a visual interpretation is very powerful. The titles of the pieces do give you a clue as to what the artist's intent is. If people can really just look at a piece and try to interpret beyond the visual as to what the statement is, and that might leave them with sort of a better appreciation of what's happening in the world today.
The Environmental Impact exhibit can be seen at the Rehoboth Art League's Homestead Gallery through September 3rd. Don't miss the Art League's other big show, the 79th Annual Members Fine Art Exhibition, also going on now through September 3rd. You can get more information on their website, RehobothArtLeague.org.
And next week on First, U.S. Senator Chris Coons of Delaware is here. He's going to share his views on the growing tensions in North Korea, as well as the ongoing investigation into the Trump administration and Russia.
Lots of interesting things to talk about. Well, those topics and more next week. That is First for this week. We thank you for watching. For Shirley Min and Nichelle Polston, I'm Mark Eichman. Have a great week.
You guys gotta get your seatbelts on.